Okay, quick tutorial on joint pain. So basically anytime that you are having breakdown of the joint diagnosed as anything from cartilage breakdown, meniscus, that kind of thing, unless you've actually torn a ligament, most of what's driving the pain is dysfunction in the muscle somewhere in the chain that goes to the joint. All joints break down because of the bioelectric flow that is firing your movements is being interfered with by something called muscle adhesions. Muscle tissue should be nice and smooth and everything flows, the nourishment and the movement patterns are controlled that way. When you get a muscle adhesion, there's a little twist there and things aren't quite firing properly. So what you're going to find is when you seek these out and find them, you're going to find really painful, tender spots on muscles that are in that chain leading to the joint. And if you roll those out and smooth them back out, not only will you greatly reduce pain, but you will also facilitate healing and you will retard the breakdown of that joint. Now, of course, as we age, these joints are going to break down, but they're breaking down for that reason. So to simply let someone operate or do a knee replacement isn't going to fix the muscle dysfunction. Okay, so that's the reasoning. So let's get into specific for the knee. So the knee is basically going to be guided by three particular places in my experience. Are going to be bothered by three specific trigger points that I have found in 99% of my clients. So if you get a tool like this or just get a rolling pin or something, it's very difficult to do it with your own hand, but you can try it. What you have to do is apply sufficient pressure to find out if there is a tender spot. Now don't just mistake the pressure for, well, of course it hurts because I'm pressing on it. It shouldn't. I've got a little knee pain here. If I roll this in here, it hurts quite a bit. So I've got a muscle adhesion going on there, and when I get that fixed up, I am going to feel so much different when I go upstairs and things like that on my knee. On this side, no pain at all. I can push in there really good. Maybe there's a little discomfort from the pushing, but there's no trigger point existing. So, whoops, three. Here's three that I want you to check. So first is going to be the muscle right here on the inner thigh, just above the knee. I want you to take something, some tool, and roll across there with sufficient pressure, back and forth. Now you may find a real biting pain in one of those areas that you didn't know that it was there. So you want to roll that out. The other is on the outer part of the thigh. Come right down, right into those tendons in there and see if anything's going on there. Chances are you're going to find one or the other. Another big place is the calf, and this you got to get pretty aggressive with. You've got to take this thing, grab maybe one over, one under, get behind that calf and really push down. You're probably going to find it somewhere where the Achilles joins into the calf muscle, and you'll come across there and it'll be a powerful pain. So if you don't find it there, try a little more on the side of the calf, maybe even up around the tibialis area here. But you want to roll those really well. Ow, right there. See, this knee's bothering me. I can't really take much pressure there, so I'm going to need to work that out. So right behind the calf and right there are my trigger points. Now, it only takes a few days of putting some pressure on here, not 24/7, but 5 minutes, maybe come back to it a little later and work it, and you'll notice that you can put a lot more pressure on as the days pass. You'll also notice your knee feels a whole lot better, and you'll be preventing further breakdown on the knee. So try that. Let me know what's going on. A lot of times people have a difficult time finding these trigger points on their own. My clients, when they walk in, I can find them like that, have them jumping with the pain, and they always think it's because I press harder. It's not that. So you got to be a little aggressive to wake them up. Once you find them, you don't have to put much pressure on them after that. And you'll have to find these, because if your knee is broke down, that is the reason. That's what causes it. All right, good luck.